and get us started. So, welcome. My name is Joni Dolce with my colleague Earl Leach here. And today's webinar is hosted through the DBHR with Washington State's Healthcare Authority. We're hoping to have an interactive training, so we encourage you to ask questions, participate throughout the session. Um, Please, just a reminder to mute your mics if you're not. If you can just all take a minute now.
Should I turn the volume up a little bit?
No, I can hear it.
Okay,
Thank you, though.
okay.
If you could just take a moment to mute your mics, that would be great. Thank you.
I'm trying to figure out which one I clicked on to get it again.
Let's see. Yes, if you could just look at your little area and mute your mic, that would be wonderful. So just a note about artificial intelligence, we want you to know that the use of automated note-taking bots or similar types of bots or tools during our Washington State FCS events or meetings does require prior approval, and any unauthorized use of such tools is prohibited to ensure the privacy and confidentiality of all of the attendees. Also, any recording that's created through AI is not recognized as an official recording of this session, and we do have the right to exit trainees from the session who are using AI to take notes without prior approval or using AI to record the session. Okay. So we've changed a little bit over the last few months about materials and recordings. So please note that materials and recordings will no longer be emailed to participants. Materials will be uploaded to the chat during today's session. And please note that facilitators will upload these as a PDF today toward the end of the webinar, just to make sure once you join, you can have access to the materials. But if you join a little bit late and are in the chat, you may not see them. So Earl or I will put them in as it goes on later in the session. And the recording from today will be accessible through the HCA FCS channel, which is listed here, and you will have access to that approximately 2 weeks after the session. So without further ado, why don't we get started? So today's webinar is one of 3 that we're planning to host with Washington State FCS. So today's session is From Burnout to Balance, focusing on strengthening self-care for behavioral health professionals. It's an hour, so it's a little bit shorter than some of our other sessions, but Earl and I are hoping to provide some tools and resources for you to use or begin using in session, or at least looking at in session, and then have these resources for after. We will also be having our second session in February on the 23rd will be Staying Grounded in Crisis, Emotional Safety Skills for FCS Staff. So please be on the lookout for February 23rd's second part of this 3 session series on staff resilience. So as the description suggested, behavioral health practitioners, such as those working in supportive housing, supported employment, routinely navigate high emotional demands while supporting others. Over time, those ongoing stressors, such as workforce shortages and other challenges, can really affect personal well-being if self-care is not intentionally addressed. This webinar focuses on developing sustainable self-care practices across multiple domains to support long-term wellness. The objectives for today are to define 6 domains of self-care, identify areas of strength, and those for increased skill development in your own self-care practice. Describe strategies for self-care within each domain, and then develop a self-care strategy. So let's do a little break the ice kind of engagement activity. So in the chat, choose a quote that's listed here on the right, give the number and one reason why you chose this one. So for example, looking at number 1, just when you feel you have no time to relax, know that this is the moment you most need to make time to relax. From Max Haig. As important as it is to have a plan for doing work, it is perhaps more important to have a plan for rest, relaxation, self-care, and sleep. And number three, to experience peace does not mean that your life is always blissful. It means that you are capable of tapping into a blissful state of mind amidst normal chaos of everyday life or a hectic life. So put in the chat what quote you would choose and why you would choose it.
Yeah. So did I. I didn't add.
If you could please make sure you're muted, that would be great. Earl, if you wanted to read off the quotes, that would be great. And I'll start working on I want to download the PowerPoint into the chat so people have that.
Fantastic.
Thank you.
So we can start with, there we go. Where do we start? Wow. It's quite a lot coming our way. So, Christy says it's an indicator of the bigger need for self-care at the time. I try to have balance in all areas of my life. I find myself saying I don't have time for a break more often than I should. So this quote relates. I can see that. Thank you, Sarah Lee. Waiting for a peaceful day is going to be a way too long of a wait. Absolutely. And Jasmine says, because I don't have hope for self-care, I will ignore it. We'll talk some more about that. Self-care is the root of mental health. Absolutely. And as I am no use to others if I do not also take care of myself. Elizabeth, yes, that whole concept of how do you pour from an empty cup? Um, Life ebbs and flows, so being able to tap into peace and calm as a tool is important. That's a phenomenal one. That's one we'll probably steal, so we'll ask permission for
Mhm.
that one. I think of finding time to plan rest and self-care time will help me remember to pause. Absolutely. So there's a great connection here. It appears everyone can resonate with that, everyone can relate, and that's pretty cool.
Great. Thank you so much. So, do you have any other inspirational quotes? Are there others that you might use?
And it's a great one here from Amy. Amy says, because life is always stressful, it's what we do with it and how we handle it. That's
Yes.
it's kind of oh, Sarah gives the quintessential one. What doesn't kill you makes you stronger. We'll talk about
Yes.
sometimes it may kill you if you don't handle it in the best way possible. So great.
Yes. So think about those quotes maybe as you're kind of thinking how you can get through a very stressful period. Maybe that would be somewhat helpful. Before we get into more of the meat of today's session, we wanted to work on a mindfulness activity. We wanted to do a box breathing technique, also known as square breathing or four square breathing, and it involves taking slow, deep breaths in the shape of a square or box. Box breathing consists of equal duration of inhalations, breath retentions, and exhalations. And according to a study on respiration practice, box breathing was effective at improving your mood and lowered your respiration rate. Just doing 5 minutes of breath work was proven to improve mood and reduce anxiety. Before you start practicing box breathing, sit on a chair with your back supported and both of your feet on the floor. And then next, follow these 4 steps listed. We'll do a couple of rounds, but it's more for you to have these resources and skills to use in your world, whether it's, by yourself, if you're a team lead, if you're a supervisor, kind of encouraging your team to take time to breathe, working with individuals participating in services. So let's breathe in for 4 seconds. Hold for 4 seconds. Breathe out for 4 seconds. And then hold for 4 seconds. So breathe in for 4 seconds. Hold for 4. And breathe out for 4 seconds. And then hold for 4 seconds. And repeating that pattern just 5 minutes daily has really been shown to lower that respiration rate. Any questions about that or anything, Earl, you'd like to add for the box breathing?
I think more than anything else, what's probably significant is to know that you have it in your toolkit. You should have that kind of ability to immediately kind of access it. So you don't want to wait until you're in troubles of stress to then go look for it. So it's a good opportunity to kind of get to know it, practice it, make it your own. You can even kind of modify it to better suit you. But it really serves a universal purpose. It doesn't have to be restricted to work. You can do this when you're dealing with your own social challenges and you're like, I just need to pause, right? And that's a great way to stay grounded.
Great. Thank you, Earl. So when we think about burnout, what comes to mind when you hear the term burnout? What do you think of? Earl, if you could just read what comes in the chat, that would be great. Or if someone would like to unmute their mic and raise your hand and we can unmute your mic, that would be great too.
So we have the usual overwork, shutdown, chaos, overwhelm, compassion fatigue, anxiety, numb, lack of emotional bandwidth. For me, I realized getting burnout when understanding and compassion for my clients is greatly decreased. That is certainly a great way to look at it, but never assume that you have that level of insight in the trolls of it. So you may want to have more clear kind of behavioral and operational kind of stuff to access.
We're going
Dislike
to
of
talk.
job or clients.
Yes, yes. All comes to my mind too, much of what you've said. Some definitions of burnout, for example, the authors of the Professional Quality of Life at the Center for Victims of Torture, which we're going to talk about the ProQual in just a bit, they define burnout as characterized by feeling emotionally depleted or drained, and it can result after a period of long-term work-related stress. And they note 3 components of burnout that we'll look at in just a bit. So here are some of the characteristics of burnout. They can be pervasive throughout healthcare domains. Staff well-being and burnout are related to service delivery outcomes and quality. It really is rooted in stress that's work-related. The components include emotional exhaustion, depersonalization and cynicism, kind of a lot of what was described here in the chat, and feelings of inefficiency. And the impact of burnout really does impact all of our healthcare domains. Um, so we're including an assessment or a discussion of burnout using that ProQual in just a minute. So it's often difficult for us to notice how stress is impacting us or if our self-care is slipping, resulting in increased anxiety and the potential for burnout. This is an assessment that's useful. When you're feeling well and in a good space, it might be a good time to identify those emotions or feelings that you tend to experience when you are nearing burnout. Sometimes, once we can notice those triggers as well as those early signs that things are beginning to maybe spiral down, it's certainly helpful. If you or a trusted friend or coworker or family member can help point out to when they begin feeling or seeing some of these signs, you might be able to utilize your self-care strategies, your wellness strategies to prevent further stress or increased anxiety. Journaling might help with this, is one particular tool. So we're not, since we have a brief amount of time today, we're not going to go into this website, but the professional quality of life measure is intended for any helper or healthcare professionals, social service workers, FCF staff here, but it's been used with teachers, attorneys, emergency response, and it's designed to understand the positive and negative aspects of helping those who experience trauma and suffering and can improve your ability to help individuals and your ability to keep your own balance. So we suggest when you're in a good place, when you're able to complete the ProQual. I've done this for myself, and it's a really useful tool again to kind of see where I'm measuring in terms of my own burnout, and then also kind of looking at some strategies or kind of helps cue you in on when you might need to bring in some of those self-care strategies that Earl's going to be talking about. So, speaking of self-care, what comes to mind when you hear the term self-care? You could use the chat, unmute your mic. Anything coming in? Oh, yeah.
Yeah, we have rest, recharging, fishing. I've got some
Fishing.
innovative ones. Yeah,
Yes,
taking
that's
time to
great.
do something that allows me to thrive versus
Hmm.
survive. Doing something for yourself that brings you peace and relaxation to recharge your batteries.
Yes.
I see the recharge as a theme here.
Hmm.
Snuggling with the dogs. Oh,
Oh,
that sounds
yeah,
familiar
that's
to
why
me.
this picture was chosen. All the pet lovers out there.
Yeah. And Christy said some it's often not supported in our society. That's a significant
Yeah,
observation.
absolutely. And you've all mentioned some of your preferred methods of self-care being fishing, snuggling with pets. So think about what are your preferred methods. And then what gets in the way of your efforts to properly take care of yourself? What happens to prevent the snuggling with the pets or going fishing or other self-care strategies that you tend to use? What gets in the way of those efforts? Anything coming in?
You've got quite a few small crises,
Yeah.
time, stress, too tired, fatigue, other things coming up, sometimes
Mhm.
guilt for using time for myself. That's
Yeah.
one to keep note of.
Yes. That's so interesting. The quote here, exhausted when saying yes, guilty when saying no. This tension is between giving and taking, between other care and self-care. So kind of knowing that um, is really important. So I think Earl's going to go over some of the self-care domains and talk a little bit about strategies to apply to those domains. So, Earl?
Thank you. So I think what's most important for us to remember here is that the goal ultimately for self-care is to really find what works for you, what is easily accessible, what you can consistently engage in, and what serves as a good cue and a guide for you to stay balanced in that kind of operational way of continuously taking care of yourself. Because most of all, what's critical for us to remember is, and I think someone mentioned it earlier, we can't pour from an empty cup, right? We can give of ourselves meaningfully and substantially if we're not taking the best care of ourselves. What is also critical to remember is we are, even unconsciously, we are modeling the appropriate behavior for the people we serve. And so often, and I can raise my hand, and most of us can, we do a better job of taking care of everyone else. And lastly, we look at ourselves. And sometimes we need to not necessarily flip that script, but to be more balanced in the sense that our words and action need to kind of align. So that when we authentically share that message with people we serve and say, it is important for you to take care of yourself, we can say, I can certainly attest to the benefits of doing so because I do it. So that it's good to have that authenticity. But when we speak certainly of the domains of self-care, we're speaking about awareness, because like for anything else, if you're not conscious and aware of what you have to do, it's very difficult to kind of address it. Absolutely, Sarah Lynn. You can't teach what you don't practice. That's a good way of articulating it. We want to make sure that we also strive for balance. And as we know, it ebbs and flows, right? It's not perfect, but striving for the balance is similar to pursuit of happiness. You have to continuously make an effort to get better at doing it. Want to have some flexibility so that we're not overwhelming ourselves with trying to take care of ourselves. We want to make sure that as we face new or challenges that we're aware of, we can constantly adjust to what the current circumstances are. We look at physical health, which is generally probably the foundation of all good self-care. Social support, oftentimes an overlooked aspect of our self-care, right? No man is an island. No, none of us can actually exist in isolation to the folks that are important. We talk a lot in FCS training about developing and sustaining good social support. And we do a lot of that working with our the consumers, our clients we serve. We want to make sure that we are once again practicing that, and ultimately to have some kind of spiritual foundation, whether that is driven by a religious belief or just spirituality in general, whatever serves to kind of keep our mind, body, soul, and our purpose kind of centered, kind of have that equilibrium. So these are some domains, and what is also just as important is that seldom do we get all great at all of those areas. The idea is to continuously strive to get better at each and every one of them and see how they interconnect and are interdependent. Because ultimately, we can't have good well-being or overall health if we don't make sure that we have some good handle on most of the domains. Any area that you see that you would add to or you think is just as critical and important for you to be looking at or focusing at when we're talking about self-care? Or one that you find to be a good either scaffold or supporter of all these that we mentioned? I want to make sure that you have a sense as to what works for you as well. So if there's anything that you want to add or you think a specific domain need to be expanded or clarified, here's an opportunity for us to have um, more clarity around that. All right, so we'll move right into really getting a good foundational understanding as to what we're talking about. So think of it. What self-care domain do you feel confident in? What's the one that either you do naturally or has been well practiced or works for you? What of the ones that we mentioned really hits home for you, really speaks to your getting up and immediately you know that's part of your regimen? And which one do you do well already? Someone said physical health, taking time in the morning, it's
Spiritual,
spiritual, yeah.
social support, awareness, flexibility. It seems like we're hitting them all.
Absolutely. And you're putting me to shame because I can tell
Yes.
you, flexibility is not my thing. I am constantly working on
Humor. I
flexibility
like that, Paula. Humor. That's a good one.
and balance.
Balance. Balance and awareness. Yes.
Yeah, reflection. So
Reflection.
great. And people are already answering what are some examples of strategy you use. How do you make that operational? How do you put those things that you find you do well already or you're confident in? How do you put that into practice? And I think someone says, I have kind of a morning routine. So that's a good thing. How other folks kind of operationalize it?
Being as self-aware as possible, knowing how much you can handle and stop to take a break. So that awareness, knowing when it's time to take a
Mhm.
break, knowing how much getting away from me, join groups or organizations that have scheduled activities for that social connection. Absolutely. Therapy for myself and actually doing the homework I'm given. I prioritize and protect my sleep schedule, taking breaks when I need them. Great examples.
Fantastic. So people already have it integrated into their daily regimen, which is a great thing. And I think someone mentioned getting that kind of professional support or engaging or connecting with organizations that kind of have a schedule so you don't have to recreate the wheel. And that's just phenomenal. I think sometimes we take for granted how much we can benefit from something that's already scheduled and organized. Simply, we have to kind of put it into our schedule. So that's a great way of doing it. But love the examples. Short walk, mounting boundaries.
Yes.
Oh, maintaining
Yeah.
boundaries. Yep.
Stopping
Fantastic.
yourself when you're thinking about work, when you're not working. Yes.
So how can you, and I think because sometimes individually we do it well, but we work in teams where that may not be reflected in the same way. So think of some examples as to how your team can adopt those self-care practices or strategies that you already have. How can you either lend that to your team or maybe introduce that to your team? So I saw someone said something about their supervisor.
Yep. My supervisor and I meet once a week, and we sometimes ask each other how our workload is looking right now. Excellent. Group stretch breaks, going on walks together at lunch.
Yeah. And that is a major adaptation that we find to be very sustaining and sustainable when you do it in at work and kind of in a group, because then even if you forget it in your, daily habits, you come to work and it starts that way. I know our team, whenever we have meetings or engagements, we integrate some, even if it's brief self-care stuff. Some of it is like meditation or 5 minutes box breathing stuff. So we integrated into that to get people used to doing so as kind of a commencement or a precursor to any potentially stressful event. Because sometimes the best way to do it is to get it before you make cross into that stressful event that you can predict. Because I know a good example is that client that just imposes a lot of demand on you, right? And you're planning to visit them, and you have to ask yourself, do I need to kind of get myself grounded and ready for this engagement? What do I do before I go there? And I know how tense I'm going to be. So that's a great way of doing it.
Yeah, our team meets once a week before the meeting starts and we do icebreakers. I love it. You could even, use the icebreaker that we used earlier in today's session
Mhm.
as something for your team.
Absolutely. And whatever works, I think after a while, it becomes nuanced to your team. It becomes just natural for you to kind of engage in it. Great way of doing it. So you're giving yourself multiple opportunities to engage in self-care. Because that's the biggest thing. The more options you have, the more likely you are to kind of engage and to sustain. And as you think about it, think about what you'd like to do better. Because as I mentioned from my own experience, I know the areas that I have to continue to work on because it's kind of not natural for me. It's not my forte. But always think of there may be areas that you can improve upon. There may be areas you may seek to have some guidance on or some more professional kind of engagement with. Not all of us are, equipped just naturally to be good at all those areas. So don't take it as some shortcoming or some inherent deficit. We all can continue to grow and evolve in that area. So remember, awareness, if we start there, we think of it is important for us to have that mindfulness, that immediate kind of conceptualization, understanding, that kind of understanding as to where we are in the sphere, where we are in the whole scope of things. It's awareness that rises through paying attention on purpose in the present moment, not judgmentally. And that's a critical one from that quote by John Cabot, which is the ability to not engage in that judgmental stuff about where we are in terms of our awareness. Because as I said, if you view it as a continuum, as something that you're constantly kind of evolving through, it is better to start somewhere than to not start that process. So it's okay to see yourself as growing and learning and evolving that stuff. But it's really, really having that good grasp of where I am, where I would like to be, and what's the distance between those 2 points. So awareness is both initial, but just as substantial as every other aspect of self-care. So what does awareness look like? We talk about having knowledge about the field of work, such as understanding of the risks and symptoms of burnout and professional impairment. So like anything else, really having some good fundamental definitions and understanding and indicators of what burnout looks like. Because unfortunately, in our society, we have some words that are overused, right? They become cliche after a while, and burnout happens to be one of them. Everyone says, "Oh, I'm burnout." I'm like, how are you able to distinguish between that and stress? And we'll talk some more about that. But being fully aware, or at least having a good working understanding as to what it means, what it looks like behaviorally, what it looks like conceptually, so that we have that awareness. Holding realistic expectations about the nature of work we do and the skills to assess the effectiveness of that work. One of the things I constantly remind folks of in this field is when we chose this field, we understood clearly, or we should understand, that there's some inherent challenges, some stress inducing engagement that is unavoidable. It does not mean that you have to succumb to that stress. It means with that level of understanding, you can have good preparatory action. You could have, like I said, a toolkit that is easily accessible, things that you know you can do preventatively, as well as things that you can do to address it when you're feeling overwhelmed. We need to have a good capacity for reflection and internal and external experiencing and monitor of our own needs. So as we face crises or challenging stuff, we want to be able to reflect on our practices and see how it internally and externally may be impacting us. And that's where sometimes having good trusted team members or supports, because oftentimes we are not always conscious or fully aware of how we're exhibiting or how we're negotiating those experiences. But a trusted source can say, "Hey, Alexandra, I noticed today you're a little more, stressed today than usual." So it's important to understand that we can't be everything to ourselves and to everyone else. And sometimes it's good to have a trusted source that can say, listen, normally, Alexander, you knock out these circumstances easy. I noticed today you seem to be struggling a little. What can I do to support you, right? You want to make sure you have that kind of support. Any other specific indicators or stuff, signs that you see that relates to awareness that you think needs to be mentioned or you can recall from your own experience? Someone said uh, having a good grasp on body signs. Yes, sometimes we know, right? If you find for me, I find my trapeze are up here getting very tight. I know as much as my head may be telling me I got this, I don't have it. I know that I'm under stress. So it's important to have that awareness.
Someone mentioned irritability.
Yeah.
Yeah. So that's what I was telling me.
If you could all just take a look at your mics to make sure they're muted, that would be great.
Yeah.
Thank you.
Thank you. So those are very good signs. So when it's physical signs, whether it's behavioral signs, whether it's response signs, sometimes it's just articulation, right? The things that we say that can indicate to us that we're not where we need to be in terms of balance. And once again, sometimes two eyes or two heads are more than one better than one. Sometimes we need to have good feedback from people that are trusted that can indicate to us or signal to us when we're not where we need to be or where we normally are. So those are good indicators. Thinking about work when I'm not at work. Yes. And that takes some specific skill and practice to navigate. So hopefully we'll be able to provide some supports in that regard. But self-care strategies for awareness can, from mindfulness to specific practices like journaling, practicing gratitude, and engaging in activities that really lend itself to us having to practice some mindfulness and not only become aware of where we are in terms of our awareness, but speaking words to it. So whether it's like the box breathing or breath work, we can do focus meditation or yoga or any other practice that really get you what we call to your chi, right? Get you into that balance, that equilibrium, that kind of place where we know what's happening around us and we have some awareness as to how we're responding to the circumstances that are around us. Journaling is a great way of having the ability to trace and track how we responded to things in a specific time. What did we use? Was it effective? Really being able to have a point of reference to go back to. Because I know from my example, and oftentimes the feedback I get, folks says, well, Earl, I can tell you, I know exactly what happens on Mondays, right? And I get the Mondays, I know how to react to it. But then there comes a Monday that simply just knock everything out of the box and it can throw your total equilibrium off and you're like, okay, there was a special Monday that I have to take note of because that can happen again. And what I noticed from past experiences that I wasn't prepared. I went in there a little overconfident, thinking I can handle all those elements. So it's important to have that awareness is not just a single event. It's kind of a continuum, an ever-flowing sense of consciousness, stream of consciousness. But does anyone or how many of you use some of these particular strategies or practices to help you in terms of your self-care, particularly around the focus of awareness? Who is does meditation, breath work, mindfulness practice. Fantastic. I see journaling is popular here. Right. And if you don't currently, here are some examples. It's a good opportunity to try them. See what works for you. See what has a knack for you. Susan, I've got to come hang with you,
Yeah,
watching
watching
wildlife.
wildlife. That's
That's one of my
nice.
favorite stuff. Yep.
Hmm.
And Dwayne says nature walks. Yes, I can lose myself in nature. I think it's great to have that.
Some great
Absolutely.
examples.
So those are some phenomenal examples. Now, once we have a sense as to how we're impacted, where we are in terms of our current state of equilibrium, we then need to be able to strive for some level of balance, right? And balance is so nuanced. But it's really about the ability to kind of really find that I call it the niche, right? Really have that sense of how do I maintain a sense of equilibrium, right? In all aspects of my life. And sometimes we we fall into that folly of believing our lives are only divided into work and home. There's a lot of other areas in our lives that expand beyond that, or even in those domains, there is actual a lot of different elements in the domains because work has from performance stuff to social elements to expectations. There's lots of domains within work that can impact you very differently. But finding that balance is really distributing one's attention to various aspects of your lives. And if you've had any significant experience in this field, you would come to recognize that the ability to shift or divide your attention to various aspects of your life is inherently challenging. So it is not a place where you get to the mountaintop and you're there and you're good forever. It's a continuous effort to get better at doing it, but it's a striving. It's a striving to get to a thriving, as someone said. So, but really finding that balance is important. So think of it for a moment. On a scale from 0 to 10, how would you rate the importance of balance to you? And we have 0 as not important and 10 as critical, extremely important. Where are you? Wow. Everyone says a 10. Interesting. Yes, it is good to have that level of awareness. So here we are, people demonstrating a good level of awareness. Everyone says, Earl, it is a 10, a 9, a 8, nothing below that. So great to have that level of awareness. Now, similarly, on a scale from 0 to 10, how well would you say you currently practice that level of balance or self-care balance? Interesting. So we have more variants, right? We have some people who are in a good place and some people are continuously working on it. So that's good to note. Here we are once again, and what I said earlier is important. These are interconnected elements of the whole realm of self-care. So here it brings in your level of awareness as well as really a concrete understanding as to what your efforts are providing or what the outcomes of your efforts so far. So it's evident that we have a place where the majority of folks are in the state of becoming, right? And continue to work on that, which is great. So let's look at some examples, some strategies for balance. Leisure time, cultivating interests and passions outside of work. And I always tell folks, we not just only have to cultivate them, we have to actually reap them sometimes, right? Because sometimes it's not just about having them or engaging, we have to be able to measure the benefits of them. Get some tangible outcomes because once we have those ways of engaging and getting the benefit from them, it's a little easier to sustain once we get the concrete benefit from them. Look at task variety in professional work. Sometimes, even if it's a team-oriented kind of practice, we have to kind of figure out where our strengths, natural strengths are, where some of our challenges are, where can we grow and evolve? How do we set good boundaries, healthy, ethical boundaries? And I know oftentimes when we talk of boundaries, the first thing people imagine is, oh, I've got good boundaries with my clients. Great. Do you have good boundaries with your team members, your peers? Do you have good boundaries for yourself? So the concept of really having good boundaries is about practicing them, fortifying them, and continuously evaluating their benefits to you. So having that sense of balance, you want to look at, and I think one of the most underrated or sometimes overlooked element of self-care, which is social support. And yes, oftentimes what the feedback we automatically get when we speak of social supports, folks would say, Earl, Johnny, sometimes social supports can be my biggest stressor. That can be the stuff that undermines all my other efforts. I don't know if it's worth putting the effort in. I haven't gotten good results. But what is of note as well is that sometimes traditionally or naturally, we tend to limit our social supports to family without understanding that we have to have different tiers of social support, right? It's important to have our primary tier, our secondary tier, our tertiary tier, because sometimes we may want to tap into resources that our family doesn't automatically have or is not good at, right? I always say, if you grew up in a family where, everything is a debate, that may not be the place you want to go to have someone who simply says, I hear you. What do you need from me? As opposed to, someone trying to fix it or someone trying to debate whether or not you're doing it right. So we have to have that level of awareness as well. Whom to go to based on their expertise, knowledge, or their capacity to get the best of our social support. But it includes family, certainly includes a lot of other areas of social support, but it is one that should not be neglected. So let's look at some strategies because the assumption is most people may have some form of social support. How strong it is, how resilient it is, or how outcomes oriented it is important to gauge and evaluate. So from friends to family, and we talk as well, and this may be new to you or this may even be novelty to you. Social support can certainly include that kind of personal therapy or engagement with a professional that offers that kind of support. We talk about promoting life balance for the practitioner. How do you find good life balance? Where your work, your family life, your social life, your recreational leisure life all really has that good balance so that you're not giving or taking too much from either one of those elements. So we want to look at how do you really lower levels of perceived stress? What are some efforts? What are some ways that we address those concerns? How do we differentiate, once again, stress from burnout? Really having a good understanding as to the concept of, and it's a constant reminder, stress is not only negative, right? There's lots of stressors that are positive. It keeps us motivated, keeps us inspired. We have to be able to differentiate between that and the stress that really impacts our emotional and our competency or our sense of who we are, our self-esteem, if it's really impacting that. Those are different elements. And never to take for granted or to overlook the importance and value of professional support. And most significantly is really having that kind of supervisory relationship that provides you that level of support in your professional realm. Why we speak to that primarily is oftentimes we find people only seek out supervision when they're already in crisis. It's important to be able to do that, to get that kind of reflective response, reflective support as you continue to work. And to know what you need. Ask for what you need from your supervisor and get a good mentor if possible to really be able to create that good, solid foundation for you to continue to work on. Very good. So any of these strategies you already have that you're attuned to that works for you as well? What are some of these strategies that you find to already be in your repertoire or you think you can immediately access or you need to access yesterday? Fantastic. Someone says professional support for reflective help. Yes,
Yes.
that is as critical as anything.
Personal support with friends. Absolutely.
Yeah. There is absolutely a place and a time and an opportunity for that to lend, immeasurable support to your
Mhm.
professional and personal life. All right. So we're going to keep it moving in the interest of time, but certainly continue to share. So it's important to not just be aware of these things and to have a sense that that's what you should do, but have a plan that you can operationalize and put in place. Because, like anything else, if you don't put this into action and measure its impact, you're only lending words to it and not action to it. All right? When you think of a self-care plan, which we all should have, because think of it, how many of you don't how many of you require, insist, reiterate to your consumers that they should have a self-care plan that they can access? And if we do that for the people we serve because we think that's principled, that's ethical, that's helpful, we need to do the same for ourselves. Because once again, these folks are relying on us to be the very best at who we are and what we can be to them at any given moment, and we have to make our self-care a priority. Right? We can't be the best helping professional if we're not helping our own self first. So think of a self-care plan in terms of what self-care are you currently doing? And I know you've mentioned a lot of folks have good awareness strategies, strategies for balance, strategies for good health care. Think of what two areas of practice will you build into your life. For those who already have some strategies that are working for them, what additional two from what we've talked about today can you add? I know someone mentioned really focusing on their spirituality. Give me some more examples of what you can add to what you already have to make it more robust and make it more, um, you know, operational for you. And while you're thinking about that, think of how will you do it? Who will support you? Critical element of it. A self-care plan without a clear, definitive aspect of who is going to support you is just a whimsical idea. Because at the end of the day, this is more a collective practice that you have to not only make others in your life aware of, but help them understand how they can support you. So we have some
Yep.
feedback.
Coming in,
Mhm.
doing a mindfulness activity during my break and actually taking a work break, leaving work at work, non-work related socializing. Yeah, absolutely. And
Fantastic.
this exercise is really meant to kind of get your juices flowing and thinking about it and, identifying what those self-care strategies are, practices, who will support you, and how will you measure it. So you can kind of use this these prompts when you return to the office as a way to really begin thinking about how you might be able to measure the effectiveness.
Yeah, that's critical because if it's not working for you, then it's just a piece of paper to have, right? And we want more than that. So we have an example here, 5 minute mindfulness, and we're going to skip that, but that's a resource that we're going to make
Yes.
available to
Yeah.
you. So you can kind of tune in. I always say 5 minutes of reflecting on yourself is a great way. But we want to look at some self-care awareness and assessment tools that you can use, a worksheet. So
Mhm.
this is a good example that you can actually use and share with your colleagues. So here we have one that basically looks at reflecting on the 6 domains of the self-care that we talk about. We spoke at length about some of them. Identify your current strengths and areas for growth. And we give good definitions of those domains: awareness, balance, flexibility, physical health, social support, spirituality. And it allows you then to rate yourself in each domain and write one strength or one area to kind of work on. And that's very significant. And I hope that I think I have a link for those worksheets. But those are helpful to really continue to gauge where you are, gauge the outcomes, gauge the performance of your own self-care plan. Because sometimes we tend to look at our self-care plan removed from us, but it's your plan and you need to be constantly gauging its effectiveness and updating it like you would do any plan that you're working on with an individual. You have to continuously update it to make sure it's reflecting your current circumstance and your current strengths. So, and we have another plan. If you could shift to the next. Yes, your personal self-care action plan is just as critical.
Mhm.
So really measuring both your awareness, your balance, and that kind of effective use and engagement with your self-care plan really lends itself to you being a better professional, a better person in your personal life, and really being able to once again model to your consumers and your colleague what is really a good reflection of self-care. As mental health professionals, we tend to give more of ourselves and neglect ourselves while negatively impacting, in so many ways. So we talk about the importance of making sure you are right so that you can do the right thing, right? That you are in a place where you can give as much of yourself without taking away from yourself. So that's just as important. And engaging in all forms of self-care. Really have some good diverse approaches so that you're not limiting yourself to one approach. But I'm hoping, and thank you, Jenny. We hope that this was helpful, really kind of stirs up your thinking, really get you to look at areas that you need to focus on. And we have a minute or two. If you have any specific questions, we'd love to hear from you. But we hope that this was really meaningful in terms of really getting you to start thinking about self-care, recognizing where you are. If you can take a moment or two to quickly provide some feedback to us on how you engage with this particular training, what our future trainings can be. We always continuously strive to make our training as responsive, as specific and germane to your circumstance so that you can have certainly more tools and encouragement to continue to do the great job you're doing. But it is phenomenal. So take a moment or two if you have it. We want to thank you. It's always an absolute pleasure engaging with the folks in Washington. We hope that this was a meaningful engagement. You had great takeaways. We look forward to seeing you in February for part two. Thanks again.
Thank you.
Absolutely.
I'm going to drop the survey in the chat.
So do provide us some feedback. We always strive to, get better at ensuring the training meets your needs, and this is the best way to do it. So provide us some feedback if you can.
Earl,
But
can you
enjoy the
drop?
rest of your day.
Yes. Can you drop the survey in the chat? I'm having a little bit of a
Sure.
problem.
Yeah, let me get that. I'll get that.
Thank you.